Hello guys, welcome back to my YouTube channel. This is Janavi from Sri Venkateshwara College of Engineering, Bangalore. Currently I am studying in second semester, Department of Computer Science and Engineering. In this session, we are going to discuss the topic is infections. It is based on the subject scientific foundation and health. Introduction. This presentation provides a comprehensive overview of different types of infections and their modes of transmission. It will help you understand the basics of infections and how they spread. By the end of this presentation, you will have a better understanding of how to protect yourself and others from getting sick. Types of infections. There are many types of infections including bacterial, viral and fungal infections. Each type of infection has a unique characteristics and requires different treatments. Understanding the different types of infections is important for preventing and treating illness. Bacterial infections. Bacteria are single-celled organisms that can cause a wide range of infections from strep throat to pneumonia. They can be treated with antibiotics, but overuse of these drugs can lead to antibiotic resistance. It's important to practice good hygiene to prevent the spread of bacterial infections. Viral infections. Viruses are tiny infectious agents that can cause a variety of illness, from the common cold to HIV. Unlike bacteria, they cannot be treated with antibiotics. Instead, antiviral medications can help manage symptoms and prevent the virus from replicating. Fungal infections. Fungi are organisms such as yeasts and molds that can cause infections, particularly in people with weakened immune systems. They can affect the skin, nails and even the lungs. Antifungal medications are used to treat fungal infections. Parasitic infection. Parasites are organisms that live on or inside another organism and benefit at host's expense. They can cause a variety of infections from malaria to tapeworms. Treatment depends on the type of parasite and severity of the infection. Modes of transmission. Infections can be transmitted through various modes such as airborne, waterborne, vector-borne and direct contact. Understanding the different modes of transmission is important for preventing the spread of infections. Proper hygiene and sanitization practices can help reduce the risk of transmission. The germ gambit, unraveling the mysterious modes of infection transmission. The germ gambit, unraveling the mysterious modes of infection transmission. This spread. Germs can be spread through airborne droplets, direct contact, indirect contact and vector transmission. Airborne transmission. Airborne transmission occurs when germs are inhaled through the air. Examples including measles, tuberculosis and COVID-19. Direct contact. Direct contact transmission occurs when germs are transferred from one person to another through physical contact. Example including kissing, hugging and sexual contact. Indirect contact. Indirect contact transmission occurs when germs are transferred from a contaminated surface to a person. Examples including touching a doorknob or a phone that has a germ on it. Prevention. Preventing infections involves taking measures such as a vaccination, hand hygiene, proper food handling, and safe sex practices. These measures can help reduce the risk of infection and prevent the spread of diseases. It is important to follow these practices to prevent yourself and others. Treatment. The treatment for infections depends on the type of infection and its severity. Antibiotics, antivirals, virals, and antifungals are commonly used to treat infections. It is important to seek medical attention if you suspect you have an infection. Early diagnosis and treatment can help prevent complications and the spread of infection. Conclusion. Infections can have a serious consequence if left untreated. Understanding the different types of infection and their modes of transmission is important for preventing and treating illness. By following proper hygiene and sanitation practices, getting vaccinated, and seeking medical attention when necessary, we can reduce the risk of infection and protect ourselves and others.